vaccine against COVID-19. This is very good news. I would take this opportunity to remind you that Canada has a world-renowned independent review process. When a vaccine is approved by Health Canada, this means that the best experts concluded that it is effective and safe.
Health Canada authorized the Janssen COVID-19 vaccine. This is a single-dose vaccine. It can be stored and transported at regular refrigerated temperatures from 2 to 8 degrees Celsius, which makes it easier to distribute across the country. As with all of the other vaccines we have secured, we're working to get doses to Canadians as quickly as possible. Canada has an agreement with Johnson & Johnson for 10 million doses of this Janssen vaccine between now and September. This morning, I spoke with Jorge Bartolome, the president of Janssen Canada. He told me that they are committed to getting the full order of doses to Canada, and they're working on setting up global supply chains as quickly as possible. There are now 4 safe and effective vaccines approved by independent regulators in Canada. We have agreements with all 4 companies making these doses, and we also have agreements with 3 additional companies for their potential vaccines. Today, we also have some great news to share about Pfizer vaccine shipments. Pfizer has informed us that we are able to move up the delivery of 3.5 million doses from the summer into the next couple of months. Pfizer will be delivering an additional 1.5 million doses to Canada this March, moving deliveries ahead of schedule. We'll also be getting another 1 million doses ahead of schedule in both April and May. For months, we've been committing to you that we'll get 6 million doses total of COVID vaccines by the end of March. Well, because of the hard work of Minister Anand and the whole team, with these accelerated Pfizer deliveries, we'll now be getting 8 million doses by the end of March. In total, we can now expect 12.8 million doses from April to June from Pfizer alone. Cette semaine, le Canada...
This week, Canada received a total of nearly 1 million doses of COVID-19 vaccines. Next week, another 1 million doses will arrive. Today, I can announce that Pfizer has moved up its delivery of 3.5 million doses that were scheduled for this summer. This means that in March, we will receive 1.5 million additional doses. We will also receive 1 million additional doses per month, earlier than expected for April and May. For months, we have been telling you that Canada will get a total of 6 million doses by the end of March. Minister Anand is continuing to work extremely hard with the entire team, and now we will get 8 million doses by the end of March. From Pfizer alone, we expect 12.8 million doses between April and June. Every day across the country, there are more and more grandparents calling their children, grandchildren to tell them how pleased they are to be vaccinated. To the healthcare workers taking part in the vaccine efforts, that's been a year now that you have rolled up your sleeves to fight the pandemic, and now you're helping Canadians roll up their sleeves to put an end to this pandemic. I want to say thank you to you. There are millions of other doses coming. We will continue. Let's continue to all work together to vaccinate Canadians as quickly as possible.
Will be there with what people need to get through the pandemic. That means we're sending more and more vaccines to the provinces and territories in the coming weeks and months. It also means we're continuing to support everyone, from families and small businesses to scientists and research staff. This week, we took another step forward for Canadian research with an investment of $518 million through the Canada Foundation for Innovation. More than ever, this past year has shown just how essential it is to continue supporting science and innovation here in Canada. En mai dernier,
Last May, we invested in providing wage support for researchers at universities and health research facilities. These employees were not eligible for the Canada Emergency Wage Subsidy. and it was important to us to help them. This investment also seeks to support research projects by helping to cover additional costs as a result of COVID-19. Today, I can share that these measures have allowed us to maintain nearly 32 people in their jobs in our universities and healthcare research institutes. Furthermore, approximately 22,000 research projects got assistance through this program, be it to maintain their essential activities throughout the pandemic, to accelerate the speed and catch up for the lost time upon the reopening. The fight against cancer and the fight against climate change and the work of our researchers is essential. They help us to improve the lives of Canadians and grow our economy. Our government will always be there to support science and the scientific community.
Speaking of building a better, stronger future for everyone, I also want to talk about what we're doing to modernize public transit. No one likes to be stuck in traffic. Better public transit connects communities and helps people get around in faster, cleaner, and cheaper ways. Yesterday, Minister McKenna and Minister Champagne announced that we are investing $2.75 billion for zero-emission buses, charging infrastructure, and other electrification projects across the country. This is part of the unprecedented commitment we made last month of almost $15 billion for new public transit projects over the next 8 years. Not only will investments like this help us exceed our 2030 target, not only will this put us squarely on the path to net zero by 2050, but these investments will also help create good jobs and grow the economy.
Yesterday, I had a virtual visit of the Nova Bus facility in Saint-Eustache. This company makes zero-emissions buses. These long-range battery electric buses can have a range of up to 470 kilometers on a single charge. Recently, the City of Vancouver's transportation system selected to purchase 15 of these zero-emissions buses and add them to their fleet. The purchase of these buses was made possible with the direct support of the federal government. This is a good example. It demonstrates that by working together from coast to coast, we can ensure that we have a cleaner, more efficient, and modern public transit system. Within the next 5 years, our government commits to putting 5,000 zero-emission buses on the roads.
Transit and infrastructure means clean air for our cities and good-paying middle-class jobs for Canadians. We not only have the manufacturing capacity here at home, but we have the materials used in today's battery technology, whether it's aluminum in Quebec or nickel in Ontario. When we build a sustainable future while growing the economy, everybody wins. There's still a lot of work to do to fight climate change and build a green economy that works for everyone, so we will continue to take real action for our workers and for our kids. Finally, I want to recognize that it's been almost a year now since COVID-19 was officially declared a global pandemic. At times, I know it feels like just yesterday, although most of the time it probably feels like a lifetime ago. This last year hasn't been easy, but we are going to get through this. This week alone, almost 400,000 Canadians got a COVID-19 shot. Next week, it'll be the turn of hundreds of thousands more. The people watching at home right now who are looking forward to getting their shot, your turn is coming. Millions of doses are on the way. Deliveries have been ramping up, and they'll ramp up even more in April. We will continue to work around the clock to make sure Canadians get vaccinated as quickly as possible. Merci beaucoup.
Thank you very much. Now I'm pleased to give Minister Anand the floor.
Thank you, Prime Minister, and good afternoon, everyone. I would like to expand briefly on the Prime Minister's comments concerning Canada's progress on vaccines and vaccine delivery. With the newly confirmed delivery of an additional 1.5 million Pfizer-BioNTech vaccine doses arriving this month, as well as the 500,000 doses of the AstraZeneca Covishield vaccine that arrived this week from the Serum Institute, Canada is set to receive 8 million doses of vaccines by the end of this quarter. Ça, c'est 2 millions de doses.
This is 2 million additional doses than what was initially forecast for that period. This is 2 million more Canadians who will be able to get the first dose of their vaccine.
More doses than was originally anticipated within this time frame. That is 2 million more Canadians who will be able to receive their first dose of vaccine. In addition, Pfizer is also accelerating April and May deliveries by 1 million doses in each of those months. With Health Canada's approval of the Johnson & Johnson vaccine, we are in the process of finalizing the delivery schedule for the 10 million doses that we have secured under contract. Deliveries are anticipated to begin in the second quarter of this year, and all 10 million doses will be delivered prior to the end of the third quarter. In all, Canada is on track to receive at least 36.5 million doses of vaccines by the end of June, and a cumulative total of 117.9 million doses of vaccines by the end of September from the 4 currently approved suppliers. Because of our diversified procurement approach, we are able to see an acceleration in doses coming to Canada from multiple suppliers. While this news of more vaccines coming is welcome and encouraging, it does not mean that the hard work is over. At Public Services and Procurement, we continue to push every day for earlier deliveries of these vaccines so that they may be deployed as rapidly as possible to provinces and territories who then can administer them to Canadians as quickly as possible. Nous aussi continuons de
We are continuing to work tirelessly to ensure that the provinces and territories have the supplies they need to deliver these doses. These recent months have been difficult for everyone in Canada and around the world. Although we have not yet finished with these difficult times, constant progress is being made, and we are confident that we will overcome this.
tirelessly to ensure the provinces and territories have the supplies necessary to administer these doses. These past months have been difficult for everyone across the country and around the world. While we aren't out of these difficult times yet, together we are making steady progress, and together we will get through this. As we have seen, our diversified procurement approach will continue to deliver for Canadians in the weeks and months ahead. Merci beaucoup, Miigwech. Thank you.
Dr. Tam?
Bonjour à toutes et à tous.
Good morning, everyone.
We will give the numbers update as usual, and then round up the latest developments that are giving us an increasingly optimistic outlook as we go into the weekend. To date, there have been 878,391 cases of COVID-19, including 22,151 deaths and just over 29,900 currently active cases reported across Canada. Over the past week, an average of 2,866 new cases and 41 deaths were reported daily. At the same time, over 2,100 people with COVID-19 were being treated in the hospitals each day, including about 560 in critical care. Although the decline in daily cases has leveled off in recent weeks, we are making important progress with COVID-19 vaccines. With continued public health measures and individual precautions to keep infection rates in check, there's growing optimism that we can achieve significant protection across the population in the weeks and months ahead. However, with the continued increase of cases involving more contagious variants, we need to remain vigilant, as the trajectory could change quickly. Over the last month, Canada has rapidly increased our capacity to screen for variants of concern, and we're now sequencing over 10,500 high-quality virus genomes, or 11% of all cases. That's within the last month. To date, more than 2.1 million doses of COVID-19 vaccine have been administered in Canada. And over the past week, provinces and territories have administered more than 397,000 doses of COVID-19 vaccine, which is the highest number of vaccines administered in a single week since vaccinations began in mid-December. With Health Canada's authorization of the AstraZeneca COVID-19 vaccines, we now have additional vaccine options to provide protection for millions more Canadians. In addition, after an expert review of studies showing sustained high levels of protection after the first dose of COVID-19 vaccines, Canada's National Advisory Committee on Immunization released recommendations that could provide access to more people faster. Based on evidence from clinical trials and real-world vaccination programs in Canada and worldwide, NACI, this committee, finds that extending the administration of second doses by up to 4 months could provide a safe and effective means to vaccinate more people sooner, while vaccine supplies continues to expand in parallel. Another piece of good news, of course, today is that Health Canada has authorized a single-dose Janssen COVID-19 vaccine. As we continue making important progress, I urge Canadians to stay vigilant, follow local public health advice, and keep up with individual practices that protect us and our families. I continue to be heartened by the stories of Canadians coming to receive their vaccines. From Gurdeep Panda celebrating by dancing the Bhangra on a frozen lake in the Yukon, to the joy and relief displayed by seniors in Montreal who received the first doses at a vaccination clinic for the community. We're all contributing to great achievements across Canada and around the world. So thank you.
Bonjour à toutes et à tous.
Good day, everyone. Today, we'll give the numbers update as usual, and then round up the latest developments that are giving us an increasingly optimistic outlook as we go into the weekend. To date, there have been 878,391 cases of COVID-19, including 22,151 deaths and just over 29,900 currently active cases reported across Canada. Over the past week, an average of 2,866 new cases and 41 deaths were reported daily. At the same time, over 2,100 people with COVID-19 were being treated in our hospitals each day, including about 560 in critical care. Although the decline in daily cases has leveled off in recent weeks, we are making important progress with COVID-19 vaccines. With continued public health measures and individual precautions to keep infection rates in check, there is growing optimism that we can achieve significant protection across the population in the weeks and months ahead. However, with the continued increase of cases involving more contagious variants, we need to remain vigilant as the trajectory could change quickly. Over the past month, Canada has rapidly increased capacity to screen for variants of concern and is now sequencing over 10,500 high-quality virus genomes, or 11% of all cases. This was in the last month. To date, more than 2.1 million doses of COVID-19 vaccines have been administered in Canada. Over the past week, provinces and territories have administered more than 397,000 doses of COVID-19 vaccines, which is the highest number of vaccines administered in a single week since vaccinations began in mid-December. With Health Canada's authorization of the AstraZeneca COVID-19 vaccines, we now have additional vaccine options to provide protection for millions more Canadians. In addition, after an expert review of studies showing sustained high levels of protection after the first dose of COVID-19 vaccines, Canada's National Advisory Committee on Immunization, or NACI, released recommendations that could provide access to more people faster. Based on evidence from clinical trials and real-world vaccination programs in Canada and worldwide, NACI finds that extending the administration of second doses by up to 4 months could provide a safe and effective means to vaccinate more people sooner, while vaccine supply continues to expand in parallel. Another piece of good news today is that Health Canada has authorized the single-dose Janssen COVID-19 vaccine. As we continue making important progress, I urge Canadians strongly to stay vigilant, follow local public health advice, and keep up with individual practices that protect us and our families. I continue to be heartened by the stories of Canadians coming to receive their vaccines from Gurdeep Pander, celebrating by dancing Bhangra on a frozen lake in the Yukon, to the joy and relief displayed by seniors in Montreal who received their first doses at a vaccine clinic for the community. We are all contributing to great achievements across Canada and around the world. Thank you.
Thank you, Dr. Du. We'll now turn to the phone for questions. The Prime Minister will take about 20 minutes of questions, and then the ministers and doctors will be around after that. Operator, over to you.
Thank you. Merci. To ask questions, please press *1 on your device's keypad. Pour poser des questions, s'il vous plaît, faites étoile 1 sur votre appareil. Première question, Catherine Lévesque.
First question, Kathleen Lévesque, La Presse. Yes, Mr. Trudeau. Inaudible for the interpreter.
On est capable d'avoir des réponses claires de la part de l'Agence de la santé publique là, sur des questions très simples comme le nombre d'amendes qui ont été distribuées. Je me demandais comment est-ce que les Canadiens peuvent avoir confiance dans ce programme si votre propre gouvernement n'est pas capable de faire preuve de transparence?
Pardon, Catherine.
I'm sorry, Catherine, but there was a lot of cutting out in the first part of your question. Could you please repeat it? Inaudible for the interpreter. We will try. There's a bit of an echo here. 2 weeks ago, journalists, including myself, have a lot of difficulty getting clear responses from public health with regard to the number of fines to those violating the lockdown. How can Canadians have confidence if the government cannot show transparency? Answer. First of all, the program exists to protect Canadians. We know that with these new variants throughout the world, it will be essential to ensure that the virus does not get imported by Canadians coming into the country. Since March, Canada has imposed quarantine measures that are among the strictest in the world. For a number of months now, we have been requiring a negative test prior to people getting into a plane to come back to Canada. Now, for the past few weeks, there is a measure where there is a test upon arrival and a quarantine in a designated hotel until the results are known. We are working to improve the process. We are ensuring that people who don't obey are fined. The system is not there to punish people. Rather, it is not there to collect money. It is rather to ensure that Canadians remain safe, that we prevent the import of the virus. And to that end, we are focusing on the effectiveness of these measures to ensure that people are protected as much as possible. That's what all Canadians expect of their government.
Oui, et on comprend pourquoi vous l'avez.
Question. We understand why you did it, but my question was really about transparency. How can you believe that Canadians can be confident in what you're doing when they can't get clear answers from the departments putting in place these programs? Answer. We regularly publish data on the measures that are in place, and we will continue to share that information because this program has only been in place for a week or two now. So we are still collecting the data. We will continue to focus on transparency and putting forward, ensuring the confidence in these institutions. Next question.
Thank you. Merci. Prochaine question, Marie Vestel.
Marie Vestel, Le Devoir. Question. Yes, I'm sorry. I thought I had pressed the button earlier. My question is for Minister Anand. With regard to the Johnson & Johnson vaccine, could you be a little bit more specific as to when the first doses will come in? You're talking about the second quarter. What month? How many could arrive initially? Will we have to wait for the end of the summer to get most of the doses expected? Why is there a delay as well? I will start with the answer, and then I will pass the floor to Minister Anand. I spoke this morning with the CEO of Janssen Canada, who assured me that they are working to provide us with greater clarity and information as to when we will start to begin receiving the Janssen vaccine. We know that we will get the 10 million doses in the next few months before September. It is very important, however, to know when we will get as many as possible and as quickly as possible. Johnson & Johnson are establishing their global production system. They have assured me that they hope to have more details with regard to deliveries to Canada, and they will share with us in the coming weeks. We will have more. For more information, I will give the floor to Minister Anand. Anita.
Merci beaucoup.
Thank you, Prime Minister. You said, in fact, everything that I would have also liked to have said, and it was a perfect answer. So with regard to where we stand with the supplier, in the coming weeks, we will have more information, and this is work that we do on a daily basis. Thank you.
Ms. Vivian, all right?
Yes, I have a more technical question. It's about the figures, Ms. Anand. If you could give us an update, as you did last week, with regard to the figures for Q1, Q2, Q3. It's starting to be a little bit mixed up. You say that we'll get 36.5 million doses by June, but what I have in my data is 8 million doses Q1, 24.5 Q2 with Serum Institute and Pfizer Moderna. So could you just give us an update by quarter and by company so that it's clear for everybody? And if you want to do it in English, okay.
Merci beaucoup. Q1, we are receiving 8 million doses of vaccine in total, 5.5 million doses of Pfizer, 2 million doses of Moderna, and 500,000 doses of Serum AstraZeneca. And in Q2, we are receiving 36.5 million doses of Pfizer, Moderna, Serum Institute, and the COVAX facility. I will allow my staff to break those numbers down of the 36.5 million for you. And then in Q3, cumulative, we will have received 118 million doses. And that is cumulative also, adding in the doses from J&J, which is 10 million, and AstraZeneca, which is 20 million doses. So that's how you get to the 118 million doses, and we are including them in Q3, but they will be spread out over Q2 and Q3. Once we get the delivery schedules, we'll provide specific information of the quarterly breakdown for those two companies that are the latest to be approved by Health Canada. I think the important thing to note, and you can see this from the numbers that I've provided, is that we have access as Canadians to multiple sources of supply of vaccine from Serum Institute and AstraZeneca, from Johnson & Johnson, from Moderna, from Pfizer, and Canada is extremely well placed as a result to continue to see vaccine coming into this country, despite what we are seeing in other areas of the world where countries have not diversified their vaccine portfolio or are being stymied by decisions that are being made to block exports. Thank you.
Thank you, Minister. Next question on the line, operator.
Thank you. Merci. Next question, Ryan Tumulty, The National Post. Line open.
Yeah. Good afternoon, sir. Yesterday, Italy moved, and with the support of the European Union, to block a shipment of AstraZeneca vaccines that were set to go to Australia. I know when these export restrictions first brought in, you were assured by European officials that this would not happen, that vaccines would not be prevented from going to countries, that they just wanted to track the doses. Are you concerned about what happened with Australia's doses, and do you fear that it might impact Canada's doses at some point?
Thank you, Ryan. It's obviously a situation we're following very closely, but I can repeat what I said earlier in terms of the conversations that we've had with the European Union, specifically that I've had with European Commission President Ursula von der Leyen, have confirmed to me that the flow of vaccines to Canada should not be interrupted, particularly given the fact that the vaccines we receive from Europe at this time are Moderna and Pfizer, and both of those companies have it has been reassured to us that those are not companies likely to face disruptions around deliveries to Canada. We are not scheduled to receive AstraZeneca doses from Europe for a number more months. We are receiving, as you know, the Serum Institute doses from India this month, and possible other doses from elsewhere in the world, but we will continue to work very, very closely with the European Union to ensure that none of the shipments of vaccines to Canada that we are going to be receiving in the coming weeks and months are going to be held back. Okay. Nous sommes évidemment.
Obviously, we are closely watching what is happening in Europe with the delivery of vaccines. In my conversations with the President of the European Commission, Ursula von der Leyen, and our counterparts in Europe, deliveries that Canada expects to receive from Pfizer and Moderna from their production facilities in Europe should not be affected by the measures put in place by Europe. We have a lot of confidence there. We will continue to monitor with regard to the AstraZeneca doses. It will take some months before we expect to receive the doses from Europe, and we hope that we will continue to be able to count on the delivery, unfettered delivery of these vaccines.
Right.
Yeah, sir. I'm also wondering, given we now have a fourth vaccine, given the additional doses you've announced today, do you think your September timeline can be moved up? Do you expect Canadians now to be vaccinated, say, by August or July?
Well, as Minister Anand just highlighted, we are expecting far more doses by September than there are Canadians, even given that we're only talking about doses from 4 different approved companies right now. So we have reasons to be optimistic. We're going to be able to move things forward. But at the same time, we also know that these are global supply chains that are being set up, and there is always possibility for disruptions. We are confident, as we have been, as I have been saying since December, that Canadians who want vaccines will be able to be vaccinated by September. But based on delivery schedules and also based on new guidelines from NACI and Health Canada, it is possible that we have further good news and good predictions to share in the coming weeks, but we're remaining focused on delivering as many vaccines as possible, as quickly as possible to Canadians, as evidenced by the good news from Pfizer today of an extra 1.5 million doses this month.
Bonjour, Monsieur Trudeau. Louis Blouin, Radio-Canada.
Mr. Trudeau, Mr. Blouin, Radio-Canada, we learned that one of your close cooperators, a member of your office, was aware of the allegations against Mr. Vance. Could you look Canadians in the eye today and tell them that you were not aware of the existence of allegations against Mr. Vance? Don't you think you should have been aware of it? Answer. First, let me remind you that for the past 30 years, I have taken the responsibility that we all have of ensuring that we have a safe workplace and places free of harassment and intimidation. I have always taken every allegation seriously. I've never hesitated to take direct action when necessary. I will always continue to take these allegations and any concerns seriously. We need to hear, accept, and listen and work in order to move forward the files of people who come forward with allegations. That's what we've always done. In this situation, the Ombudsman went to see the Minister to share concerns about confidential allegations. The Minister directed the Ombudsman to independent authorities responsible for these investigations. Politicians have to ensure, or the Office of Politicians have to ensure there is a follow-up for these allegations in an independent and responsible manner, and to ensure there are consequences for those who commit such actions. But there are independent authorities. They are the ones who must do the follow-up. In this case, the authorities did not get the information from the Ombudsman, and therefore there was not enough information to follow up with a deeper inquiry. But at each stage, we will always take that information seriously, and we will ensure at each stage that the men and women working in the Canadian Forces or anywhere in Canada can always be listened to and respected and supported through the processes necessary to get through this. With regard to what I said and what I continue to say, I was only made aware of the allegations against General Vance by journalists in the recent weeks and months.
For the past 30 years, from my very first days as part of the McGill Student Society Sexual Assault Center, I have always taken extremely seriously our collective responsibility to ensure safe work and study environments and to fight against sexual harassment and assault. It is something that I have never shied away from. Indeed, as leader of the Liberal Party, have not hesitated to take swift and necessary action on responding to such allegations. It is the responsibility of elected officials, upon learning of allegations, to ensure that they get followed up on appropriately by responsible, independent officials and investigators. That's exactly what we did in this situation. When the Ombudsman came forward with allegations to the confidential allegations to the minister directed to the appropriate independent officials to follow up on those allegations. The ombudsperson did not provide sufficient information to the officials in place to be able to follow up on these allegations. But that is something that we will always try to work through in a responsible way. Women and men who serve in the Canadian Armed Forces or work anywhere in Canada need to know that when they come forward with concerns and allegations, they will be heard, they will be listened to, and they will be able to have a process through which they can ensure an independent evaluation and examination of their allegations. This is something that we have always taken very seriously. As I have said, I only became aware of specific allegations against General Vance through the work done by global investigative reporters over the past weeks and months.
Good afternoon, Prime Minister. Christy Kirkup with the Globe and Mail. How can you allow the military to investigate itself, especially when it involves sexual misconduct allegations involving the top ranks? And why don't you commit to what has been recommended for decades and set up an Inspector General office that exists in other countries, including Germany, the US, and Australia?
We moved forward immediately on ensuring proper internal investigations in the independent systems within the military, but at the same time, the minister has committed to moving forward on establishing a more independent external process to move forward so that we can truly demonstrate our commitment to everyone who chooses to serve Canada, that they will be supported and protected in issues like this. Le ministre a indiqué.
The minister indicated immediately that he would follow existing processes of independent investigations within the military, and that we would also move forward with the establishing of more independent external reviews to ensure that anybody who's serving their country within the Canadian Forces will know that there is a place and a way to be heard when there are allegations or issues involving intimidation and harassment.
Mr. Tom Perry, CBC. Women who say they experienced sexual misconduct while serving in the military say that they've lost confidence in your defense minister over his handling of these allegations against General Vance. What do you say to these women?
That we understand that there have been challenges and incidents and problems around sexual harassment and sexual assault and intimidation and inappropriate behavior in our military, like in so many institutions and organizations around this country. And over the past 5 years as a government, we have taken significant steps to improve and enable people to be able to come forward, people to have confidence in not just reporting mechanisms, but also in transforming workplaces and work environments so that people can be safer and fully respected in dignity. This is something that we continue to work on, that we take extremely seriously as a government and as a country. And we will continue to work with survivors, to respect their wishes, to hear them, and to improve the systems that both support them when things happen, but even more importantly, create cultures where incidents of the sort don't happen from the very beginning. Nous savons qu'elle
We know that within our Canadian forces, as within many organizations and institutions across the country, that for many years there have been far too many incidents of harassment, intimidation, and assault. It is our duty together to work, to continue to work, to create a system where people can report and get justice, but also to prevent this from happening within these institutions or allowing this to continue by not being strong enough in the actions we do and the processes we put in place proactively. In the past few years, we have put in place many things. We have much left to do. But I repeat that we will always be there to listen to and support and accompany those who have been subject to harassment and intimidation. And we will be there to improve the workplace culture, organizational culture, in order to ensure that there are fewer and fewer such instances in the future. Everyone serving their country should not be subject to intimidation or harassment.
With Global National, just based on what you knew and when you knew it about General Vance, had you been aware of the allegations against him, would you have still extended former CDS Jonathan Vance's term? And should your minister or your staff had told you about these allegations when you were considering extending his term?
I'm not going to engage in hypotheticals. What I will say is that there is a strong and serious and rigorous investigation underway, and we are moving forward with further measures to create structures to give even more confidence to Canadians about the support we give to survivors and the changing of cultures within the military and other institutions. This is something we take very, very seriously, and we will continue to move forward in ways that keep people safe.
I won't comment on hypotheticals, but what I will say is that we are conducting a strong and rigorous investigation to have all the facts on the situation and look at how we can improve the systems and structures in place to, first of all, ensure that complaints or concerns are better followed up on with the appropriate authorities, and to ensure that the culture does not allow this to occur again.
Good afternoon. Mia Rabson from the Canadian Press. Now that Johnson & Johnson has been approved, we have 2 vaccines that potentially could also be produced in the United States. Just wondering what conversations you're planning to have now with the United States about getting doses from there, what Canada can put on the table to try and convince the Americans to help export, and what timeline you might think that Canada could get doses from the U.S.
As I've pointed out, we've had excellent conversations with the American administration on fighting COVID-19 and on the integration not just of our supply chains, but of our economies across the Canada-U.S. border, which means we do need to be working together to make sure we're coming roaring back from this pandemic as quickly as possible. Obviously, in terms of sourcing vaccines, it's going to be extremely important that we get the vaccines that we have been contracted for, including from production facilities in the United States, and that as we move forward into the coming months, we do everything we can to support each other as we move forward. Those conversations are ongoing.
Glenn McGregor, CTV News. Prime Minister, we heard yesterday from the premiers about the growing wait lists, the huge backlog of elective surgeries, in some cases in diagnostic testing, caused by the pandemic. They want an increase in the Canada Health Transfer, as you know, but you've said you want to wait until we get through this before you have that conversation. They say they need to know now when the money is coming. Will you consider accelerating that process to increase the Canada Health Transfer in this year? And if so, are you willing to meet their 35% of the health costs that they say the federal government should provide?
From the beginning of this pandemic, the federal government has been there for Canadians. We've transferred billions of dollars to the provinces for their healthcare systems, for things from PPE to rapid testing to vaccinations now. But we've also worked to support their healthcare systems and ensure that we're able to get through this pandemic. We've also sent hundreds of billions of dollars directly to Canadians. Indeed, through this pandemic, over 8 out of every $10 on pandemic supports for Canadians has come from the federal government. We have demonstrated our willingness and our desire to work in partnership with the premiers every single step of the way, and we will continue to. The priority for all Canadians right now is to get through this pandemic. And that's what we're focused on, and that's what we will continue to do. We made a simple promise. We will be there for Canadians as much as it takes, as long as it takes, to get through this pandemic, and that's something that applies to the premiers as well. Now, as we get through this pandemic, and once we're on the other side, it is obvious that there will be a need for greater financing of healthcare in this country, including through the Canada Health Transfer. And as I've said to premiers, we will be there to increase those transfers. But that conversation needs to happen once we are through this pandemic, because right now, the supports we're giving to Canadians are the ones that are needed to get through this pandemic. And that's what we're going to stay focused on while we work hand in hand with the provinces.
Since the beginning of the pandemic, we made a promise to Canadians. That promise was that we would be there for them as long as it took, with everything that it requires. And that's exactly what we've done, including with the premiers of the provinces, to whom we have transferred tens of billions of dollars to ensure that, yes, they have the equipment they need, but also to ensure that the healthcare system can continue to operate during the pandemic. It's clear that after the pandemic, we will need to invest more in the healthcare system, and the federal government will be there to do that. But as we have demonstrated with our presence in people's lives, is that 8 out of $10 provided during the pandemic has come directly from the federal government. We will continue to do everything necessary throughout the pandemic to help people. After the pandemic is over, yes, absolutely, we will sit down to speak with the provinces and territories about how to increase healthcare transfers and ensure that Canadians are well served by a renewed post-pandemic healthcare system. Absolutely, but those conversations must take place after we get through this current crisis.
Thank you.
Are you still confident in the decisions being made by Minister Sajjan, the Minister of Defence? Yes, absolutely.
There are a couple more questions as well.